For me, golf is important in a lot of different dimensions in my life. It takes you to beautiful places. There's really nothing quite like hitting a good golf shot.
Oh, that was a great drive, Ed. You killed it. Man,
much better than that, can you?
I'll tell you, terrific.
Well, you know, I've had to contemplate the prospect of not being able to play golf, because there have been times when I really couldn't play golf without a lot of pain, and really sometimes I couldn't play at all. I tried a lot of physical therapy. I tried the chiropractic. I tried epidural shots. I tried a lot of things. None of it really helped for very long. I went to see Dr. Regan, and he suggested that I consider a coflex surgery.
So as we began to discuss the surgical options for Ed, spinal fusion was an option that came up. We discounted that option because Ed wanted to have an active lifestyle. And for that, it meant golf for Ed. This is when we discussed the option of interlaminar stabilization with coflex. This is an operation that's minimally invasive, takes less than an hour, patients are up the next day, and over a matter of several weeks they can return to their normal activity. And for Ed, that meant returning to golf. Since coflex is not a fusion procedure, it allows patients to maintain flexibility, motion, rotation, and for patients like Ed, it allows them to return to their normal and athletic activities that they love to do.
After the coflex surgery, I was walking the same day. Yeah, almost immediately. As soon as the anesthesia wore off, I was able to walk. You know, after the surgery, when I realized that the source of the pain had been extinguished, I realized that, hey, there's a brighter future ahead. You know, there's golf in my future. There's all the things that I like to do.
If you have back pain, buttock, or leg pain, it may be a sign of spinal stenosis. And if you do have spinal stenosis, you may want to consider coflex as an option in treating your condition.
If you have spinal stenosis, you may be a candidate for coflex. Consult a doctor to understand the differences between treatment options. In a clinical study, most patients who received coflex were up and walking the same day. Coflex is an FDA-approved device, and there are doctors in your area who are trained in this surgical process.
I'm one happy guy. I'm doing something that I couldn't have done 6 months ago, and it's something I really enjoy doing more than just about anything.
Coflex is a medical device used to treat the symptoms of moderate to severe lumbar spinal stenosis that is surgically implanted in skeletally mature adults following a decompression procedure. Coflex is not for everyone and should only be considered following at least 6 months of non-operative treatments. To find out if you're a candidate for Coflex, contact a doctor who specializes in spine care. For patients receiving Coflex, some of the more common risks included continued pain, wound healing problems such as infection or drainage, brief numbness or tingling in the legs, and bone fractures. In some patients, the Coflex device may not help your pain, and you may need another surgery to remove the device. It is hard to predict who will not benefit from this surgery. Please refer to the Coflex patient labeling or ask your doctor about all warnings, precautions, the full list of potential adverse effects, and who should be implanted with the Coflex device. The patient labeling or your doctor can provide a description of the risks and benefits of the Coflex device and procedure, as well as clinical data showing that the Coflex device is in fact safe and effective. Discuss your alternatives with your physician and select the treatment method that best seems to meet your current pain level and lifestyle. This content is for promotional purposes only and does not replace having a conversation with your doctor. The claims made in this content are based on the clinical data and results found in the US FDA PMA P110008, October 2012. For more information on this study and other findings about Coflex, please visit the Coflex website at www.coflexsolution.com. Coflex may not be surgically implanted unless a patient has undergone at least 6 months of non-operative conservative treatments, such as medication, therapeutic intervention, or epidural injections.